Alright, what's up YouTube? I'm back finally with another video. I'm so sorry for the long wait, but it's been crazy going back to work after maternity leave, having a baby. You know, it's a lot going on, but we're finally here. If y'all see little feet or anything in the background, it's my little brother. But yeah, so today's video, if you have already read the title, it's going more in depth about what I do on a daily basis at my job. I'm so passionate about it. I absolutely love what I do. I love my patients. I love everyone that I work with. So I thought, why not? Because I do get a lot of questions about it. So I'm like, okay, let's go ahead, let's do this. So I'm gonna go ahead and answer a few of the questions that some of you have actually asked me. And I kind of added a few in there myself, just things that I feel like you guys should know. So as you all might know from watching my first video, I am a surgical assistant. I work very closely with 3 periodontal dentists, or doctors, and I actually am able to also am working with the general dentist, well, 2 of them at my job. So I get the best of both worlds. I get to do surgeries, and then I also get to help those that have cavities, things like that, do fillings, root canals, all those stuff. So yeah, so the first question is, what is a periodontist? People don't even know that they exist. Some people don't even know that there are specialties in dentistry, which is crazy, but you know, that's what I'm here for. So a periodontist is a dental specialist or a doctor that specializes in diagnosing and treatment of periodontal disease. So what is periodontal disease? Periodontal disease is a gum infection that can damage the gums and can cause pain and discomfort and destroy your jawbone. A lot of people don't know that. Crazy enough, it's very common. And it can be one little thing that you do every day that you don't even know you do every day that can cause it. Even we have a lot of patients that come in that are just like grinding and clenching at night. That can cause a lot of pain. You know, movement and mobility of the teeth, which causes even more mobility in your gums, because you know, everything's moving around in there and it's like, what's going on? So with those type of patients, we give them a night guard. You know, and some of y'all might clench and do that with your teeth and not even know it. Now, a lot of people want to know, how do you prevent periodontal disease? What people don't know is that it's caused by, most of the time, it's caused by poor hygiene. You know, a lot of people aren't brushing 2 times a day. A lot of people aren't flossing 2 times a day, let alone 1 times a day. You know, not using their mouthwash, things like that. You know, that's basically how you prevent it. Make sure you're brushing 2 times a day. Make sure you're flossing at least once. And, you know, that mouthwash helps get things out. And there are some mouthwashes that even help with your gums. Just like there's toothpaste. I always recommend Sensodyne. It's the best. I have sensitive teeth, so I always go with that when it comes to talking to some of my patients. Sorry if y'all see me looking down, I wrote a couple notes, so I might just be going back and forth just to remind myself, you know, because it's a lot of information to remember at once. So like I said, when it comes to preventing and, you know, causing periodontal disease, like I said, it's poor hygiene. You could lose teeth just because they become so mobile because your gums aren't able to hold them in place anymore. Another thing is, make sure you're going to the dentist. Go to the dentist. I don't care if you're brushing 2 times a day. I don't care if you're flossing 2 times a day. I don't care if you're using mouthwash every day. I don't care. You need to go to the dentist and get a cleaning. You need to see your hygienist at least once a year. I would recommend twice a year, but some people don't have time for that. I understand that. But you have to see your dentist because your toothbrush and your floss, they're not going to get everything. We have a lot of patients that come in and they have wonderful teeth and they're brushing and flossing like they're supposed to, but there's still plaque, there's still calculus there in places that you can't reach all the time. And that too can cause periodontal disease. And then you're going to be coming to see me in a lot of pain. And honestly, once you get periodontal disease, there's no cure for it, just a bunch of wonderful treatments that can, you know, help with the process, help with the pain, help with the discomfort. But your gum tissue doesn't just grow back. It doesn't work like that. And when it comes to bone loss, your bone doesn't just grow back like that. It doesn't work like that either. Once it's there, once it's happened, it's happened. So you want to do what you can to make sure you prevent it from happening. A common procedure that we do for a lot of our patients is a deep cleaning. Now, so with deep cleanings, and this goes into your consultation. I'll go more in depth about a consultation with the periodontist as well. But during your consultation, there will be a time where they're probing. And if you've been to your hygienist consistently, you already know what I'm talking about. There's an instrument called a probe, and they basically use that to measure your gum depths. And with that, basically they see you know, how much gum you basically have, so it can go, we've seen patients go up to as high as 15, which means there's really nothing there holding that tooth in. But if you come in and you have like 4s and 5s, we can help you by doing a deep cleaning. Anything between a 1, 2, or 3 is perfectly fine, perfectly normal. Anything 6 or above, honestly, the periodontist is going to be like, we have to fix this. We have to change this before it gets worse. So if you have, like I said, if you have 4 or 5, that's when we do our deep cleaning. So a deep cleaning with the periodontist is called scaling and root planning. It's not like a normal cleaning with your hygienist. It's similar, but it's not the same. It's a little bit more in depth, and it involves I'm sorry, it's a lot. It involves the removal of plaque and calculus, and it's the smoothing and planing of the exposed roots. So basically, like, we use an instrument called a cavitron, and it literally cleans off all the plaque, all the things that your toothbrush can't get to. Normally, it's like behind the tooth, and it's an amazing process. But it is basically like a surgical procedure. You do have to be numb for it. It can be uncomfortable if you don't get numb for it. But yeah, it's just a deep cleaning, making sure, you know, you get all of that icky stuff. It also helps prevent your, you know, the gum disease from getting bigger. And sometimes when we do scaling and root planning, we don't even have to do the whole mouth. Sometimes it's like just the lower, just the upper, or even just the left side, or even just the right side. Or one quadrant on each side. You just never know. It really depends on, you know, the person, because we have a lot of people that come in and they only chew on their left side. So the left side is feeling the most pain, whereas the right side is fine, or vice versa. So another question that I have gotten was, what do assistants do during the procedures? We assist. We hand all the instruments to the doctor. If they're probing, we put in the probing depths, the furcations. We put in the mobility if the tooth is moving. We have to memorize every procedure we do at this point, honestly, because we have to think we have to be ahead of the dentist, or the doctor. Basically, we have to be ahead of them just to keep the process moving. It makes it harder when the doctor has to reach and grab things, and it's easier for you to just, you know, get the process out. Some surgeries can last as long as like 3 hours, depending on, you know, what the patient needs. So it's just easier to have those extra hands to kind of, I guess, like kind of think for you and move the process along faster. Another common thing is we suction. We make sure nothing's going down your throat. We make sure that if you have any spit, or saliva, or any blood, all of that, we suction that so it doesn't go down your throat, so you don't choke. That's you know, what we do during those procedures, we make sure we think ahead for the dentist, hand them all the instruments, but we also, you know, we talk to you and keep you calm. And not even that, when we're in surgeries and the patient is on an IV or anything like that, you know, we also have other assistants that come in and, you know, watch the vitals, because that's important too. Especially because we have patients that come in that might have diabetes, high blood pressure, heart disease, you know, like all of those things. We have to make sure we monitor pretty much everything as assistants. We pretty much do it all. So the next question that I received is daily duties. So obviously one is we assist in surgeries. We set up for surgeries. We sterilize instruments, and then we complete chart notes, whether they came in for a consult, whether they came in, I don't know, just to do a CBCT scan. It doesn't matter. We have to do notes on that patient. We complete letters with our to general dentists with our periodontal doctors. Basically, in the letters, we just state what we did that day. And we send it to the general dentist just to keep the communication going. And general dentists send us things too, which is great. We flip rooms. Flipping rooms is just cleaning the rooms, making sure everything is sanitized, sterilized, clean. We schedule appointments. Sometimes the ladies up front can't get to it. We get super busy. So with that, we will schedule the next appointment, or, you know, whatever they may need, we handle. Sometimes we work up front too, if necessary. We do have 3 locations. So sometimes our ladies up front are taken to another location. One of the assistants has to go up front and help. And we also order supplies. We do x-rays, we do impressions, we take panoramics, which is another, I guess, like another x-ray, another, and then we also take CBCT scans, which is very similar to a panoramic if you've ever had one. Panoramics normally are done in orthodontics, so we don't do them that often, but we do a lot of CBCT scans because they help us with our implant surgeries. And when the patient's getting an implant, we kind of just focus mainly on that area so we can find out how big the implant needs to be, or how wide, how small. Like, so CBCT scans are very, very helpful. And let's see. Another question. Surgeries that I have performed in, or that we perform in, or whatever. So we have LANAP. So the LANAP is a laser surgery. So basically, the doctor will have a laser, and it's I'll put pictures of setups and things in here, and you'll kind of be able to see that. But basically, it's like a laser used around your gum lines. I love this procedure because it's one of the easiest ones to assist in, honestly. But not only that, but it's also the least painful for the patient. There isn't a lot of pain, discomfort afterwards, which is great. And then we have our SRP, which is scale and root planning, which is the deep cleaning that I mentioned before. So with that, like I said, it's used with an instrument called a cavitron, where they're removing plaque and calculus, things just built up over time. We also do grafting. We have connective tissue grafting. We have free gingival grafting, and we have soft tissue grafting. With the grafting, for that, sorry, it's so much information. I'm trying to get it all out. So with that, we will take tissue from the palate of your mouth, and a lot of our patients have recession here in the bottom, and we'll take that and we will place it there, and that will help lessen the amount of recession you have, which is so cool. And even better for the patient, because we're taking something from you and making another part of your body, you know, it's improved. So that's a really interesting surgery that I absolutely love. Sometimes those surgeries can last, like I said, we have surgeries that can last up to 3 hours, depending on how extensive, you know, the disease is. We also have crown lengthening. So there are some patients that the crown of the tooth, the top of the tooth, is like basically covered under the gum. So we'll basically remove that. It might be an hour procedure, but they're pretty easy. It's just removing that gum tissue that's covering the crown of that tooth. And most patients get that, you know, when they're about to get implants, when they've had an implant placed or things like that. So that's basically what that is. We have biopsies. I'm pretty sure a lot of you know what a biopsy is. Biopsy is just, you know, removing tissue, sending it off to a lab to see what it is. Sometimes it could be cancer, sometimes it's not. You know, you just things like that. Implant placements. So, and like I said, I'll post pictures in the video somewhere. I don't know if it's going to be at the end or whatever, but I'll place the pictures in there so you guys will see exactly what I'm talking about. Implant placements. They look like little nails, honestly, is the best way for me to describe it. But like I said, I'll put a picture in it. It's just, so when patients get a tooth removed, they can get an implant in place. And on top of the implant, you can place a crown. So it looks like there's nothing missing. We have a lot of patients that actually opt for doing that because they can last you a long time, last longer tongue tied than like veneers and stuff like that, all the expensive stuff that patients get. Yeah, so then we also do extractions. We have a simple extraction where, you know, your normal like just pulling the tooth. You go on about your day. You might get a suture, sometimes you might not need it. It really depends on the patient. And then we have our extraction with bone preservation. So we do have donor bone that we get, and this sounds really crazy, but the best way for me to describe it is it is a donor bone. So once you get your tooth extracted, and this is mainly for patients that have a lot of major like bone loss, and they want an implant placed. Excuse me. So that is just so the implant has somewhere to go. You know, if there's nothing for the implant to go into, there's no way there can be an implant placed. So that's the extraction with bone preservation. My favorite procedure that I love to perform in is the Lanap. Like I said, it's the easiest one to assist in, but it's also the least painful for the patient. And I've seen a lot of patients go through it and they're like, wow, I can't even tell that I just had gum surgery. And that's what I love the most. At the end of the surgery, we create like a Band-Aid with the gums. So the patient isn't allowed to, you know, drink out of a straw. They aren't allowed to really chew in the area. It's a lot, you know. You just had surgery, so there are obviously post-op instructions that you have to follow. But it's literally my favorite. Something that I came up with was questions you should ask your periodontist. One, if you have to go to a periodontist, you need to ask them, what is periodontal disease? What does this mean? What are symptoms of gum disease? And I'll tell you guys some of those next. How will this be treated? And those list of surgeries that I mentioned to you are options for patients. And what should I expect? You should ask them what you should expect before, like, you know, with gum disease, if you decide not to treat it, what you should expect after the procedure. If you decide to opt in to get it, you should ask those questions. And going back to the question of symptoms of gum disease, there's a lot of them, I'm sorry. Bad breath, halitosis is number one, okay? The recession of gums is number two. It's really kind of, I don't know, they're kind of tied, because you'll be able to see if your gums are not covering the roots of your teeth. If you can see like the bottom where if your tooth is mobile and able to, yeah, you need to go see a periodontist. Toothaches, bright red gums, loose teeth, tender gums, tooth loss, or even tooth mobility, bleeding, swelling, discomfort when brushing and flossing, or even biting. Those are really big signs of periodontal disease, and you should really go see one. Now, what happens at a perio consult? So there's a lot that can go into this. So first thing is what you should expect. So if say you go to your general dentist first and they notice that you're having gum recession, or they notice that you have a mobile tooth or whatever, they're probably going to send you to a periodontist. And what will happen is that we'll come in and we'll see if your general dentist sent us any x-rays, or if they sent us a referral telling us exactly why they sent you to us. We'll take a look at that. And we'll also ask you, like, a lot of questions, especially about your medical history and your dental history. Like, how often are you brushing? How often are you seeing your general dentist? Things like that. You'll come in and we'll take your blood pressure, just so we can monitor. So every time you come in, we can see, like, hey, this is how she started, or this is how he started, and now his blood pressure, he was 114 over 70, and now he's like 149 over whatever. We take a look into those things, so we can also make sure that you're not anxious and you're not uncomfortable. And once that is done, we'll go ahead and bring the doctor in, and then we'll start perio charting, which is what I mentioned about with the probe, where they measure your gum depths. Now, if your general dentist says full mouth perio, that means we have to probe every single part of your mouth, and that can take some time. Whereas if they say, oh, it's just the mandibular, or it's just the maxillary, then that's where they'll probe. Whereas if we have a lot of patients that self-diagnose too. They find us and they come in, and we'll do probing. We'll take full mouth x-rays, ask you about your medical history again, take your blood pressure. The only thing that's missing in that is that you weren't sent or referred by a general dentist. You kind of self-diagnosed, which is fine too. It's just important that you go see a periodontist if you notice these things, especially if you're noticing those symptoms that I mentioned off to you earlier in the video. So that's kind of what you should expect at a perio consult. It's nothing too much. They're also going to lay out treatment options for you in the end of the at the end of the consult. And you decide whether it's something you want to do or not. Most of our patients definitely go for it because it's huge. People don't realize how important it is to go see your dentist. Like, I can't even tell you how many patients that I've read about that didn't go see a dentist, and they died from infection in the mouth, or something that could have been prevented, just getting that tooth extracted, or just going to get a cleaning. Those simple things. It's super important. And a lot of people don't even know how to do the correct oral hygiene, like how to take care of themselves. I'm probably going to do a video about that. How to brush, how to floss. A lot of patients don't know how to do that. A lot of patients brush their teeth as if they're scrubbing a toilet, and you shouldn't, for one. You really need to, brush in circles and avoid the gums. Do not brush your gums. That will cause recession. That is what the mouthwash is for. That is what the floss is for, okay? If you brush your gums, you're just pushing them back, pushing them away. And once they're back, it's nothing you can do other than get a connective graft, or whatever the periodontist is advising you to do at this point. Flossing, you want to floss in like a C shape, and like I said, I'll do a video on this, a real quick video, probably sometime this week, right after this one, just so you can get a closer look at how to take care of your teeth. And then I'll also give you a list of my products that I use. I think I have pretty nice teeth. But yeah, oral hygiene is important. Just like going to see, a doctor is important. Just to get a checkup, it's important for you to go see your dentist too, because all of that is part of your health. But yeah, that's pretty much all the questions that I had, or that I can remember off the top of my head that I've been asked about my job. So yeah, thanks for tuning in. That's pretty much it for this video. I'm so sorry that it took forever. It's been a lot going on, guys. My baby is 2 months. She's going on 3 months in about 8 days. So you can only imagine what me and her dad have been going through, especially going back after maternity leave. It's been crazy. I can tell you that some videos that I'm going to be coming up, that are going to be coming up on my page soon, oral hygiene video like I mentioned before. I'm also going to talk about postpartum depression, you know, and what it's like to deal with that. I only had a touch of that, so, you know, I'm going to go in depth about that, like maternity leave and all that stuff, and how our relationship was affected, and just stuff like that, stuff for y'all to look out for, hopefully within the next week or so. But yeah, make sure y'all comment, make sure y'all like and subscribe to my video. I hope y'all enjoy this, and if y'all have any questions, my social media will be linked down below, especially when it comes to oral hygiene. A lot of people don't know about any of that stuff. At the end of this video, make sure you keep tuning in, because I am going to insert some pictures and things with setups for surgeries, and yeah, a lot of other things that I mentioned. Even I'm going to even put some pictures of gum disease in there so you guys can know how serious it is. So make sure y'all tune in, but to that at the end of the video. But please comment, like, subscribe, share this video with your friends and family, because people need to know how to take care of their mouth, because y'all don't be knowing. I can tell, okay? We have patients that come in there and we know you don't be flossing and brushing like you're supposed to, okay? So with that being said, thanks again, guys. See you later.